Welcome, everyone. Today, we're tackling one of the hardest parts of turning 65, and that's all of the information surrounding Medicare. There's a lot of information. We're going to unpack it for you today in clear, concise, plain language.
So whether you're just starting Medicare, renewing your plan during open enrollment, or helping a parent or spouse navigate their coverage, this conversation is designed to help you understand your options and how all these pieces fit together, and truly the biggest differences between traditional Medicare and Medicare Advantage. So we're going to cover what all that means. We're going to cover changes coming in 2026, how to evaluate your options, and what key questions you can ask as you go through this.
Our goal isn't to tell you what to choose. Our goal is to give you the information for Medicare Parts A, B, C, D, supplements, and Medicare Advantage, give you all of that information in clear, easy language so that you can feel confident when you make those decisions as you move forward.
So Kim just mentioned those Medicare parts, so that's exactly where we're going to start. Let's start by defining those.
Hey, let's take a minute and introduce ourselves. Adam, you go first.
Sure. So my name is Adam Gross. I am the founder and patient advocate at Peak Health Advocates. I live in Massachusetts, but I serve nationwide.
My name is Kim Feth. I'm the founder and CEO of Healthcare Survival Kit. I'm also the lead advocate. I live in North Carolina, and I'm also available nationally. All right, Adam, why don't you break down all of the different parts of Medicare?
Sure, Kim. So Medicare is the federal health insurance program for folks over 65 and some under 65 with disabilities. And there's four parts that you'll often hear about. Part A is labeled hospital. What does that mean? Inpatient hospital care, along with some other services like skilled nursing facilities. Part B is called medical. So that's not really that helpful because isn't this all medical? But what they mean by medical is the typical services that when you go to your doctor for your physical or to your cardiologist, when you get equipment that you'll see called durable medical equipment, all of that is Part B. Now, I'm going to go out of order really briefly. I'm going to go to Part D, and that is prescriptions and medications. And now I'm going to come back to Part C because Part C is called Medicare Advantage, which we're going to talk about in more detail coming up. The important thing, or an important thing about Part C Medicare Advantage is that that is a bundled option that is offered by private insurance companies. And what I mean by private insurance companies, United Healthcare, your local Blue Cross, Blue Shield, Cigna. When you hear those names, those are private insurance companies. So we're going to keep referring to traditional Medicare and Medicare Advantage throughout this session, and we're going to describe those differences. The plan that you use, if you're already on Medicare or are going to Medicare, the plan you use or will use is either traditional Medicare or Medicare Advantage. You do not have both, and we'll come back to how you figure that out and how you think through that coming up. But Kim, why don't you take a second and tell us what Medicare Supplement and Medigap is, because that's really important too.
I'd be happy to do that.